was the question. Now, there were a lot of problems with that because a lot of women in the study the average age was 63, and they had to give, everyone in the study couldn't know if they were on estrogen, so you had to have women that didn't have hot flashes. Now, for anyone who has hot flashes, if your hot flashes are gone, you'd know about it, right? So being on estrogen is not a surprise, not a secret. So those women were not in the study. So many of the women who were in the study were older. And what do we know about older people? They've developed heart disease. Heart disease is the #1 killer of women in the United States. Not breast cancer. Heart disease is the #1 killer of women in the United States. So these women on hormone replacement therapy in this cohort, that was their question. Does estrogen help prevent heart disease? And looking at this study, we found out that actually estrogen decreases your risk of breast cancer. So I actually want to look through the data, okay? Because this is huge. Nobody actually talks about this. But before the data had a chance to be analyzed appropriately, there was a big press conference, and it went to the news that estrogen causes breast cancer. There was big clickbait. Everyone was terrified of estrogen. Who thinks that's a big risk? Not at all. Especially when we heard before that it decreases your risk of stroke, decreases your risk of diabetes, decreases your risk of cancer overall, decreases your risk of dementia, decreases your risk of heart disease, which is the #1 killer of women in the United States. So to me that sounds like, no, estrogen does not increase your risk of breast cancer, and we can safely give it to women because the benefits significantly outweigh the risk.